We do have a big problem. You and other clinicians and healthcare systems are trying to address it. Where are we headed in the future to try and bridge the gap between healthcare disparities that exist today?
Racial and ethnic minorities do have worse outcomes in acute and chronic conditions. So what can I do? What can medical schools do? What can institutions do to make us a little bit more aware of what our patients want? Because at the end of the day, you can prescribe any medicine in the world or any treatment in the world. If the patient doesn't take it, it's a failure. There have been studies that have looked at the trust level between populations in poor neighborhoods and doctors that look like them, and will they trust them more to do a lot of these preventive tests versus a doctor who doesn't look like them. There's a lot of energy and resources put into diversifying our medical student population, our residency population, and our faculty. We're trying to proactively look at all of our patients and look at those that live in the poorest zip codes that tend to be Black and Hispanic in New York City and reach out to them ahead of time to say, hey, you know, we've got information that you haven't had a mammogram yet. It's called patient navigation, and experiments like these are happening all over the country where we have to be accountable for our patients. So if we reach out to them, we may have to call them multiple times. Can we arrange transportation? And then we may have to offer them a mammogram on the weekend or at night. A lot of these things are coming into place, and when we show the powers that be that, hey, we're actually improving screening rates for breast cancer, or hey, their diabetes control or their high blood pressure control is going down, or most importantly, look, they're not getting hospitalized as much, they're not going to the emergency room as much. So there's a lot of positive changes that have happened even from when I started as a young attending physician in New York in 2001. A lot more team-based approach to taking care of patients and a lot less just me individual.